over the last 24 hours, we have identified 1,640 new cases of COVID-19 in Alberta and completed about 16,800 new tests. This means our positivity rate is still high at about 8.9%. There are 685 people in hospital, including 121 who have been admitted to the ICU. Looking to schools, there are currently active alerts or outbreaks in 430 schools, or about 18% of all schools in the province. As a reminder, junior and senior high students are now learning at home, so while we are attributing cases to these 430 schools, only 293 of these are still open with students. Currently, all of these schools together have a combined total of 1,726 cases. This number includes 109 schools on the watch list. Sadly, there have now been 653 deaths related to COVID-19. My thoughts and sympathies are with all the family, friends, and communities grieving the loss of someone they loved. Today, I also want to provide some additional information on surgeries from Alberta Health Services. As I mentioned yesterday, COVID-19 is impacting our health system, and AHS is putting additional surge measures in place in the Edmonton zone. These additional measures, as I mentioned, include postponing as much as 60% of non-urgent, scheduled surgeries that require a hospital stay. Within these constraints, the government and Alberta Health Services are still working to ensure as many Albertans as possible continue to receive needed surgeries in the coming days. As I mentioned yesterday, AHS will continue to support Albertans who require emergent or urgent surgeries. This includes surgeries resulting from major or minor trauma, urgent cancer, cardiac, or vascular surgery cases. AHS is also working to continue to perform as many surgeries as possible across the province. Depending on the number of Albertans with COVID-19 who are hospitalized in different zones and sites, surgeries will continue to the maximum extent safely possible. To make sure that as many of these surgeries as possible can continue, we all need to work together to reduce our cases so the pressure on the healthcare system is reduced. The vaccine delivery announced earlier by Minister Shandro is exciting news. It is remarkable that we will have a vaccine available in the same year that this pandemic arrived in Canada. However, as I've said before, while the arrival of a vaccine is positive news, it will be some time before we can immunize most Albertans. Until then, we must be the vaccine for each other. Finally, I know that there are many questions about the new measures announced yesterday, and we are working hard to address them. Please continue to visit the alberta.ca COVID site for updated information and guidance. I have heard some confusion specifically around outdoor gatherings and would like to help clarify. As of yesterday, outdoor social gatherings with anyone outside your household are prohibited. This includes getting together in a park or around a bonfire. We have not changed people's ability to participate in outdoor sports and recreation in groups of up to 10 people. This reflects the ability of people to do these activities while keeping distanced and wanting to keep options open for physical fitness in outdoor settings. However, I am also asking Albertans to please follow the spirit of the restrictions that are now in place. This is about reducing the spread, not finding loopholes. Please don't go skating or skiing with groups of friends if you can go with your household instead. Stick to your household. If you are unsure about what to do, please err on the side of caution and make the safest choice. Remember, the goal is to bend the curve, not the rules. This is a challenging virus. While COVID-19 cases can accelerate very fast, they decelerate more slowly. The long incubation period means that hospitalizations and ICU admissions will likely continue to rise in the coming weeks. In other words, the path down the peak is much slower than the way up. With respect to the metrics, so the R value for the province, and we calculate that once a week, the R value for the province as of the end of last week was 1.13, so still above 1. And we are looking to bend that down below 1. Again, that would indicate that we are shrinking the number of cases. And in addition to that, we do need to bring down the number of new daily cases that we're seeing every day, because even a relatively low R, if we're still seeing a high number of new daily cases, can be a concerning combination. So we're working to put together a combination of different metrics with very clear triggers, and that choice about which triggers to use. Again, there's no one metric that's going to be perfect, so we are going to have to look at the pros and cons of those, and a final decision hasn't been made with respect to the exact, that suite of measures and those specific triggers. But what we do know is that we need to bring our new daily cases down. That will require a decrease in our R, and it will require, again, that we're seeing that continuous lowering day over day of our number of new active cases.